Hello, everybody. My name is Chris Hernandez. I'm a third year nursing student at BCRN. I also have some classes at QU as well for my bachelor's degree program that I'm in there. This presentation I'm doing on is inflammation. What is inflammation, you ask? Well, inflammation occurs when their body interacts or encounters, an offending agent like viruses, bacterial, or any toxic chemicals, or suffers an injury. It activates your immune system. That result can be pain, redness, swelling, bruising of the skin or the area that's inflamed. There are several parts of your body that can be affected by inflammation, such as obesity, diabetes, cardiovascular disease, eye disorders, joint pain, arthritis, Alzheimer's disease, believe it or not, asthma, allergies, colon, breast, or lung cancers. So what inflammation does pretty much, it swells up the area that's infected or injured on the body. It's like a defense mechanism that goes to attacks it and find out what's going on with it, what attacked it, attack that area of the skin. So it's going to go there and try to fight it off. It's almost like an invasion of your skin, and we're sending out our fighters to fight that inflammation. There's several causes that may cause the inflammation, such as autoimmune disorders, such as lupus, where your body attacks healthy tissues. Exposure to toxins like pollution or industrial chemicals. It also untreats acute inflammation, such as from the inflammation or the infection of the injuries. So it can cause several different things to your body as well. Let's see what else I have here. I chose information of asthma because I do have asthma. I've had asthma all my life. So, asthma, what it does to inflammation of the airway for asthma is based on the response of non-pathogenic ciliaris, which means is in your lungs, it closes up your airway, constricts, where you're not allowed to get a lot of air through your body or through your lungs to breathe better. So there, you take a bronchodilator or things of that nature to break that up and to open up your airways so you can get more air in your system and breathe better. Then it also has inflammation of the effect of all compartments of airway, including your upper respiratory system, tract, and the nose. There's like two types of inflammation in asthma. One type would be it favors the development of a strong cellular immune response. This causes troubles breathing throughout the day, even if you take a high dosage of asthma drugs like inhalers or steroids or anything to open up the airway for your lungs so you can breathe better. You have a type 2 where it favors a strong immune response to the type of symptomatic allergic response that can result in increasing asthma and decreased lung function. What that means is for allergies wise, like I have year-round allergies, so I take Benadryl every day, and that seems to help out a lot. So with my asthma, if I know if I'm allergic to something like pollen in the air or something in the community, I have trouble breathing because it gets in my lungs and starts constricting my airway. So I have to take a bronchodilator, like my breathing machine or my albuterol inhaler, just to open us up, just to get some air in so I can breathe better. Let's see. What's bad about inflammation is, it doesn't heal. You can never heal on that. It causes, like I said, your body parts to swell up. For instance, if you have a bite from a bug or anything of that nature, you hit it on something or any injury to the body itself, your body is going to fight it off and figure out what's going on, what happened to the body. Your immune system is going to kick in, and then inflammation is going to go to that site. So you're going to have, like I said before, you're going to have the redness, the swelling, the burning, the bruising, things of that nature, like I mentioned before. But it can be curable, but you have two different ways to clear, but it can't clear. For instance, Did the inflammation go away? No. There's a yes and no answer to that response. When acute inflammation goes away within hours or days, chronic inflammation can last months or even years, even after the first trigger is gone. So what that means is if you have a chronic means long term, acute means onset. So it happened right then and there, like you stepped on a nail, so you have the inflammation on the spot right then and there. Chronic would mean like asthma, lung cancer, or anything like that's going to restrict the airwaves. Or, lupus, like I said before, that's going to be chronic. So the chronic part of it could last months. It could last years. There's really no cure for it. But an acute situation, like for asthmatics or something, how you get that cure is from that albuterol inhaler or a breathing system or breathing machine or nebulizer, things of that nature that will clear it up faster for you. Other than that, there's, I can go on and on about information. There's several different components that go along with it. But that's pretty much how the inflammation attacks the body. And there's other, there's ointments you can take. There's topical creams you can take for inflammation. Anything to take the swelling, the redness. You can use ice even, heat. You don't want to put heat if it's open. If there's an open wound, you do not put heat for the inflammation. It just, you're going to tear up the skin, and you don't want to do that. You have more skin problems and inflammation at that point. So other than that, that's my presentation. I'm a little nervous, as you can tell, but I'm trying to do the best I can. I just want to thank everybody for listening to my presentation. I hope everybody has a great day. And if you have any questions, feel free to leave me some comments for how to do this better. I'm fairly new to this, so I just want to tell everybody thank you again, and you guys have a great day. Thank you. Have a great day.